We're talking about what's true and what isn't when it comes to the coronavirus, especially your risks of getting it. Let's face it, not knowing the facts could be a deadly mistake. Some of the biggest coronavirus myths include the safety of wearing a face mask, the idea that young people don't get the disease, and whether or not social distancing is effective.
Joining me virtually is Seth Wells. Wells is a professor of epidemiology and biostatistics at Drexel University. Seth, thanks for joining us.
Thanks. I'm really happy to be here.
Let's start here. What is the biggest myth when it comes to the coronavirus?
Oh, there are several really big ones. One is that face masks somehow do not work. That they don't control the spread of infection, and nothing could be further from the truth. I mean, data are coming in, studies are coming in, and it's really showing how effective masks can be. Even if you're wearing a mask, if you're infected, some virus does make it out, very little. I mean, it really does cut down on the amount of infected droplets that you breathe out. At the same time, some can get into the air. And, it's very important so that if there are droplets, if there is virus in an aerosol, it might actually fall off. It's important. I really believe in social distancing.
Yeah.
I mean, even with a mask, I will not sit out even in restaurants now.
So what other myths? Sorry to cut you off there. What are some of the other myths that you discovered?
Well, children somehow don't get infected, or children get disease, and these are myths. I mean, we have studies now, have reports from groups of how effective kids are at spreading. There was that whole outbreak at the Georgia summer camp, where a large percentage of the kids, became positive for the virus. They've even done studies looking at sort of, nasal secretions in little kids versus adults, and they've seen actually more virus there than counterparts. So we don't know how effectively they can spread to other members of the family, but we know they most definitely have virus.
How do you suppose these myths get started? Is it fear of this coronavirus pandemic? Is it when government steps in and shuts things down? What's the catalyst to some of these misconceptions?
I honestly think that people have an aversion to being controlled, and actually see this not as a public health, but as a way of somehow diminishing their personal freedoms. And nothing could be further from the truth. I mean, all we do in public health is try to give guidelines and enact, measures that actually preserve life, reduce infection.
This is a hard question here because of social media and the way that things spread via Twitter and Facebook and a lot of misinformation. How do you convince somebody that they're wrong if they believe in one of these myths?
Look at credible sources of information. Look at real news sites. Don't depend on Facebook. Don't depend on Twitter that sometimes have, sort of reports that have been doctored, have been cherry-picked. Look for it. Look for credible news sources, and in the end, the data, the findings, they don't lie. They will really tell you what you need to know.
Yeah, be sure to cross-reference credible sources that we had discussed earlier too.
That's how you convince people. If people do a search on credible sources for use of face masks, it's out there. They're very effective, and that wearing them somehow will not reduce your amount of blood oxygen and make you feel like you're passing out. There have been those studies, misconceptions, and none of that is.
Do you suppose or think that at this point, researchers, scientists, public health officials, do you think they fear the public doesn't trust them anymore?
Well, I mean, you hear it all the time. I think sometimes when public health, and we don't get heavy-handed, but we make very strong recommendations, I think it can be misinterpreted and people don't want to believe us. They don't want to follow us. And, you know, I don't want to call public health holistic, but when they get sometimes very strong in their recommendations, people tend to push back. And I think that's when they tend not to try, they don't want to believe us. But the data are there. And there have been other times in the history of public health when public health measures have worked really well for infectious, for epidemics. So they should embrace public health science, you know.
And of course, we're patiently awaiting this vaccine. However, there are some myths associated with this vaccine production. You know, Russia recently approving a vaccine. What do you make of some of these myths that have come about based on us waiting for a vaccine?
Well, first of all, the myths around that somehow it's not going to be safe, it's not going to be carefully tested, those are myths. The FDA is going to be involved in every aspect of rolling out this vaccine and testing it. You know, just have made modifications in the design, already in the production of potential vaccines to really roll it out more quickly. It's not that it's going to be somehow compromised in terms of its safety or effectiveness. So people don't have to be afraid about that. Just today, I noticed there was a poll, and a fairly large proportion of Americans said they would not take the vaccine, they would not use it. And that, truthfully, is the way we're going to get any sort of population immunity, you know, against this pathogen.
We've talked about the myths. We're going to push them aside just for a second here to make sure we're informative. Tell us what we know for sure about this coronavirus now that we're months into the pandemic.
Well, we know it's highly infectious. We know that there are definite risk factors for the spread, being in a closed area, not wearing some type of mask in those areas, not observing physical or social distancing. All of these are risk factors. And when you do those, your risk of getting infected goes down dramatically. So we really do know that. And we do know that, let's see, also the outcomes, that there is a relatively minor but a significant amount of severe outcomes associated with infection. And we know this, and it is very diverse in its outcomes. That, you know, it ranges from respiratory failure, pneumonias, to cardiovascular symptoms, to neurological symptoms. I mean, it is quite varied. So we know this now, and period. And no one is immune from this virus. It really has spread across all age groups. And certainly there are high-risk individuals, people who have to take special precautions, elders, people with pre-existing, comorbidities, co-infections or co-diseases. These are people who really have to be very careful. So that's what I can tell you. We know that now. We know how to prevent it at this point. We really do. And so this is all good stuff, and it happened in record time. People, it seems like it's been a long time, but it really hasn't been a long time in terms of studying epidemics.
Further emphasizing a need to wear a mask, to social distance. And speaking of wearing a mask, something I've seen pop up on the internet, on social media, is this thought that if you wear a mask, that it could some way affect your breathing, that you're breathing in carbon dioxide. That's a myth.
That is a myth. There are no cases of carbon dioxide poisoning that we've been able to actually really record. They've done studies to look at blood oxygen levels in people wearing these masks. They are not, decreased in any sort of way that is significant. So we know that it really doesn't do that. People should realize that there's only health benefits to wearing masks in this age of COVID. know what's happening? Sadly, more and more people are knowing people who are very sick or dying. And they realize, concoct the story, this is not a hoax. I mean, I had a first cousin who died of COVID out in California just recently.
I'm sorry to hear that.
1 week, he had no pre-existing conditions. He was my age. He went in 1 week from symptoms to death. So it's a real deal, real. And I think people more and more are seeing this. And as a result, maybe I should listen to Tony Fauci.
Right,
Said that,
right.
I didn't want it to be political, but we should be listening to real experts like Fauci, who tell, and honestly, not listen to politicians.
All right, Seth. Thanks again,
Thanks
man.
very much.
Sounds good. Seth Wells, professor of epidemiology and biostatistics at Drexel University. You've been very helpful. Thank you so much for your insight here, clearing the fact
Thanks
from
for
fiction.
inviting me, and very happy to talk to you. Thanks.